Patient assessment. My partner and I arrive on scene. We check for scene safety. The scene is safe. We see one patient not moving on the ground. We see no other patients. We see no need for additional resources at this time. I'm going to ask my partner to do a manual stabilization of the C-spine. My general impression of the patient is he is a male, unresponsive, late 20s, early 30s, suffering from a trauma. There's a ladder nearby, presumably he fell. I will now assess his level of responsiveness. Sir, can you hear me? Patient doesn't respond. Do a painful stimuli. Patient doesn't respond. Presumably he's unconscious or unresponsive at this time. I will move on to assessing his airway. I'll do a modified jaw thrust and listen for adequate breathing. It is not adequate. I will ask one of my assistants to measure and insert 2 NPAs and an OPA. Patient accepts. We'll move on to breathing. I'll check the trachea for any GVD or deviation at this time. I will expose the patient's chest to see if there is any signs of crepitus or trauma on his chest. I will note if there is anything in that area. Because the patient is not breathing between 12 and 20 breaths per minute, I will have one of my assistants administer a bag valve mask at 100% O2, high flow, at 12 to 20 breaths per minute, or 1 breath every 5 seconds. Patient does not require any suctioning at this time. I will move on to assessing the patient's circulation by checking the central and radial pulses. Patient has a pulse. I will note the rate, rhythm, and quality of the pulse. And then I will check for hemorrhaging of the patient. I do not see any blood loss or bleeding at this time, so circulation seems to be okay. I will note that the patient's skin color, temp, and appearance seems to be pale, cool, and clammy. I will see if there are any bystanders or family members nearby that I can ask for patient's sample history. I will then decide that the patient is a high priority patient, needs to be transported immediately. I will call for a paramedic intercept and have dispatch call the hospital to alert a trauma team. I will ask one of my assistants to get a C-spine collar and a longboard to assist with extricating the patient.